friends, welcome to Therapy Thursdays on Louisiana Living. We are physical therapy and balance centers. I am Angela Yarborough and this is Dr. Jerry Yarborough. And what are we doing here? Well, we are talking about different disease processes, and we are just talking about different ailments, different things that keep you from loving your life. That is one of our mottos, is love your life. And we just wanted to give back to the community and just give you some things that you can do for some things that might be preventing you from loving your life. So why don't you tell us exactly what we're going to be doing?
All right. First, like you said, I'm Dr. Jerry Yarborough, physical therapist, and my sweet wife, Angela. By trade, she's actually a nurse. So, together, I opened the Jonesboro Clinic about 20 years ago. I actually have about 27 years experience as a therapist. And then 7 years ago, we opened up here in Ruston. And just about 3 weeks ago, we opened up in El Dorado, Arkansas now. So what we're doing, like she said, is we're talking about different diseases or impairments that are affecting your quality of life. And at Physical Therapy and Balance Centers, our desire is to help you love your life. So we're going to discuss those impairments. We're going to discuss how physical and occupational therapy can help you rehab from those impairments. And then we're going to always give you a takeaway of what you can start doing immediately to start making a change in your life and improving your quality of life. So again, come and see us every Thursday here on Louisiana Living. You can look us up on myarclemis.com or our personal Facebook page, physicalruston.com. Or you can even go to our Facebook page or even our YouTube channel. We have lots of videos and lots of education out there to help educate the community. Now, we want you to come back in the next two segments in which we'll start talking about certain ailments or impairments. And then, like I said, what physical and occupational therapy can help you overcome those impairments. And then again, we're always going to leave off with what you can do immediately to start helping improve your quality of life. So come back and see us and we'll get started. Thank you.
Welcome back to Therapy Thursdays on Louisiana Living. We are physical therapy and balance centers. I'm Angela Yarborough and this is Dr. Jerry Yarborough. I see something over here in the corner. Is that something we're going to talk about today?
Actually, it is, yes. Yes. We're going to be talking about custom orthotics today.
Okay. Custom orthotics.
Orthotics.
Okay, so what's the difference between these and something that I see on the shelf at Walmart?
Over the counter, stuff you get at Walmart. You can save a lot of money, but you're basically throwing it away because that stuff you get off the shelf is not made for you or anyone. It's just, it's just over the counter,
Right.
So custom orthotic, though, is made specifically for the person. So orthotics, for those of you that don't know, are like inserts that you put in your shoes, and they can move from shoe to shoe. But these custom ones are made specifically for your abnormalities or conditions, that you need.
So how do you know what I need?
Well, so first, as a physical therapist, what we're going to do is we're going to analyze the way you walk. So we're going to have you take off your socks and shoes. We're going to look at the condition of your feet, see what's going on, make sure your toes are all pointing the right direction, see if you have any calluses or bunions, or we're looking to see if you maintain an arch, in the bottom of your foot. We want to make sure that you have an arch and that you're not flat-footed. We're going to be looking at your heel to make sure your heel is nice and stable whenever you're walking, and it's not, turned one way or the other. That'd be calcaneus, valgus, or varus. We're going to be looking at, are you walking with proper biomechanics? That would be typically the way God created us to walk, was that we're going to hit on our heels first, then you kind of roll on the outside of your foot, and then you come across your forefoot and then off on your big toe. So a skilled physical therapist is going to analyze what you're doing. Now here at Physical Therapy and Balance Centers of Ruston, Jonesboro, and El Dorado, we have some very innovative equipment, and it's a force plate. You're going to walk across it. The computer's going to analyze how you're walking and the pressures you're putting on your feet during those different phases of gait, and it will detect whatever abnormalities you have. And from that, we can send it to the lab, and the lab with the therapist input is going to make your custom orthotics to either correct or support the abnormalities that you have. So come back in the next segment, and we're going to talk about this just a little bit more and some things that you can do to help the condition of your feet. Okay? All right, welcome back, guys. Dr. Jerry Yarborough, physical therapist and owner of Physical Therapy and Balance Centers, here with my sweet wife Angela today. And what we're talking about is custom orthotics. So in the previous section, I talked about how a physical therapist is going to analyze your gait pattern and any abnormalities you have in your foot structure and also in the biomechanics. And here at Physical, we have some very innovative equipment. It's called the Foot Max. It's a force plate. And what we have is our patients walk across the force plate, like my sweet wife's going to do here. And what it's going to do is it's going to analyze their gait. Come back one more time for me. Okay. And so what this is going to do is it's going to analyze her gait and any abnormalities that she has. And with the scan and our visual inspection, we're going to be able to tell the lab what kind of adjustments that we need to make her some custom orthotics to help improve her biomechanics and or any abnormalities she has structurally. And you know, it's very important that our feet are operating correctly, because that's what we stand on. And if you think about it, if the base of what you stand on is messed up, then everything else up above can be messed up. So, you know, abnormalities in your feet can cause foot pain, knee pain, hip pain, back pain, and even neck pain. So custom orthotics can really help improve impairments in your quality of life. Now, a couple of other exercises I want to show you real quick. If you do have some weakness or abnormalities in your feet, some good exercises that you can start doing immediately at home is you're going to throw down a towel on a slick surface. We can use the Foot Max today, okay? So we're going to put this down here, and Angela is going to put her foot on there and just crunch it up, okay? Just try to crunch that towel up and just work on that for about 5 minutes a day. And you're really going to build up the intrinsic muscles of your feet. Another real easy exercise is to just get a handful of marbles, put them down, pick those marbles up one at a time with your toes, okay, and move them. Nice easy exercise that you can do at home. As you can see, it takes a little getting used to, okay? And then you're also going to want your ankles nice and strong. So you can use something like some TheraBand, and you can do some easy ankle exercises at home. Now typically you're going to be seated to do this, okay? But we're going to work this resistance in all the planes of movement. So you're going to pump it like that, you're going to push it out and pull it in, okay? So those are some great exercises to help build up the intrinsic muscles of your feet, to help support the structure of your feet so that you can use proper body mechanics, which is going to decrease the amount of energy it takes to walk, decrease the impact that your body's getting when you walk, and all of that is going to help decrease your pain and improve your quality of life.